Are there any children sleeping in DCF offices? So that story from February was an anomaly because it led the, your mic's not on.
It was not true. The story in the paper was not accurate.
But your PIO was quoted as saying there haven't been any children sleeping in an office since November. So there were children sleeping in offices?
Prior to, yes, in the past, there have been, probably for the history of the agency, there are children who might have stayed overnight in an office. That is not, and I would say that that is not, certainly not the norm, and it's also not something that happened as a placement. Like, it's not, would never have been long-term. It would have been overnight or one night while we were trying to identify a congregate care setting or facility for the young person.
So in the story where they talked about that the cubicle, I believe, it's my words, it could not have been a cubicle,
Yeah.
it could have been an office, was decorated or designed in a way to make the child
It
feel
was
good?
not.
None of that happened?
No.
Okay. Okay.
Not that you're asking anything wrong, I'm just, Assemblyman, what was the story, what was
It
the
was a
article?
February NJ.com article.
Okay.
Okay, so, and Assemblyman Scharfenberger asked about lodging, so you'll take care of that. So in the story that you're saying, so are you saying the part in the story where the accusations were made that employees get attacked by students was, or not students, I apologize, but by kids in the system is also not accurate?
No, I think the challenge about that particular story is that there were a number of issues that were conflated that did not happen the way it said it happened. Did a young person punch a casework supervisor in the office? Yes, in fact, that happened. Was that young person who punched the casework supervisor, had she slept in the office? No, she hadn't. She had been in a foster home, and she was kicked out of school, and they picked her up from school, brought her to the office. That's where she ended up. There was an altercation, and she ended up, hitting the staff person. But they conflated this young person having slept in the office, which was not true. So that's what I'm saying to you.
Okay. So in the instance of the young person who hit the employee, was any action taken, or like, how do you handle that? Like, do you call the cops? Like, how does that work?
So I think it depends on, the staff person who is assaulted has the ability to be able to press charges. They have the ability to be able to, we would call the cops. We have security advisors that are in the building that they can not put hands on young people, but they can reach out for assistance to local law enforcement. Our staff are trained to be able to de-escalate situations, and so I think I wasn't in the office this day, so I don't exactly know what happened, but from all of what I read, she was not, it was not de-escalated, it continued to escalate, and she ended up striking a worker.
Okay, got it. All right. The next question is, at one point, you guys had instituted something called a solution-based casework program. Is that
Yeah.
something that's still in effect in the department?
No, actually, solution-based casework was something right during COVID, or just, I want to say it was during COVID, that we ended up bringing on as an enhancement to our case practice model, thinking that it was going to be helpful in terms of deeper engagement with families, that particularly around investigation. And, it was being implemented for the last couple of years, and through evaluation, repeated evaluation and quality improvement initiatives, we determined that it was not something that was having the added benefit that we expected, and so chose to discontinue that.
You discontinued, okay. So how are you then, how do you then track what's going on with, like, we hear a lot of times from various departments, we need to invest in technology, and, the governor recently announced this dashboard thingy for permits. Like, so how do you track the progress of the children that are under your care with the work that's being done?
Yeah, so that's not solution-based casework. Solution-based casework has nothing to do necessarily with how we track the work. So we have an Office of Analytics and Systems Improvement. We have a very robust data collection system, research evaluation team, co-QI. We've developed a continuous quality improvement, what we call collaborative quality improvement. And developed an Office of Monitoring to actually look at the quality of the services, how we're spending our state dollars. And so that's how we track and monitor the outcomes and the metrics across the entire department.
Okay. I just want to, actually, I want to follow, because I was thinking about what you were saying just now. When you talked about lodging before with Assemblyman Scharfenberger, you mentioned that, if I understood you correctly, you don't separate out how much money you spend, whether it's for a family or if it's just a child, right?
Right now, right, we don't, there's
don't
not
break it
a
down
way
into
to
other categories.
indicate that it's specifically for a child in a hotel as a result of behavioral health needs versus if it's a family who is homeless.
How much do you have that total number?
I don't have it with me. We have it, though.
You have it, you just don't have it here?
Yeah, right.
Okay. All right. So if you can get that through the chair, that'd be helpful. My next question, in the FY 2027 discussion points, they cite an average wait time of 92 days for out-of-home behavioral health services and 240 days for out-of-home services for youth with intellectual and developmental disabilities. How many children are in those wait periods?
I think we provided the information in a response through the OLS question, so I can look at that and see what that number is right now. But it varies. It depends on the number of young people who have, presented to perform care, an assessment is done, and then it's identified what level of treatment is determined, and then then they may automatically get into a placement if there's one available, or they may end up on a waiting list if, there's a lengthy list. And so, but yeah, it does vary. And I think, one of the biggest challenges, and not something we've shied away from talking about, is the decrease in the number of congregate beds available in our state for children. We have a reduction, I want to say, of over, 250 to 300? I want to say it's like 250 to 300 beds that we've lost since COVID. Some of that goes back to what Assemblywoman Murphy was talking about with workforce and the challenges with workforce and wages. And some of it is just the challenge of providers not being able to afford their liability insurance or, the other costs associated with operating a nonprofit. And all of those things have converged in some cases that providers maintain a certain number of beds or programs for us, but have had to let go of 10 or 20 beds. And so those have accumulated over the course of the last few years. And so it has become more challenging for us to be able to meet the needs timely of the young people who are waiting for out-of-home care.
So how do we solve it?
I think one of the ways that we solve that is through the mental health roundtable that I talked about, that we have a multidisciplinary team that includes the courts and attorneys and the juvenile justice system and DCF, which includes DCP&P and the Children's System of Care, along with national partners that have been doing some of this work, to come together to say, like, what's the short-term and long-term, approaches that we can take, because we know that having a child not get the supports and services they need just further delays or can further complicate some of their challenges. And so it's not for lack of, trying to tackle this, but really using the data and the information available that we've been collecting to be able to help drive us towards solutions. And so that's something, that roundtable now has a couple work groups, one looking at service array, and the other work group is looking at data to really further refine that, the population. And so I think, continuing to move forward with those efforts.
So
and
when
then
do you
that
think those
determines, what do we need? Do we need to build something new?
So when do you think those reports or findings will come out? That
I
can
mean,
then be
I'm
implemented?
hoping that, I expect that the next commissioner is going to continue that. He's actually been participating on the roundtable in his previous job and role. And so now, he'll be able to step in and continue and have all of the background on this. And so, my hope is that the short term is going to be in the next 6 months or so, because, we know we have to do something quickly.
So you've talked about staffing, and every department does, and in particular yours, just because the job is so emotionally taxing on
Yeah.
people, right? So there is supposed to be a staffing and oversight review subcommittee that hasn't published an annual report, I'm told, since December of 2024. Is there a particular reason why?
Just there was the Staffing and Oversight Review Committee, it's actually their next report is supposed to be out like this week or next week, like they're that close to being done. And there was a change in the vendor that was being used for that. So originally it was the Camden Coalition who agreed to step in and kind of help them to design and set up metrics initially about how they were going to be reporting out. But said they didn't want to do it long-term, and so Montclair University ended up taking it over. And so there's been just, I think, a little bit of shift with that transition that has caused a bit of a delay. They expect, though, that once this report is published, like very quickly, the next report will be published on time and with what's required
So
in the legislation.
This report, which hopefully should be coming out soon, as you're saying, it's going to be for what year?
It'll be 2025.
It'll be 2025. Okay, all right. You had talked about a couple
I
years
think.
ago, right?
2025 or 2024?
2023?
I'll confirm it, but I want to say it's 2025.
Okay. You had talked about a couple years ago about launching an app called the Youth Mental Health Outreach app. 2 years ago, in the FY24 budget, you had $1 million. I'm sorry, in the FY25 budget, you had $1 million for it. Last year, you had 500,000, and this year you have another 500,000. Is this app up and running?
I believe that the money, we ended up having that, it went through the second floor hotline because they already had kind of the beginnings of their hotline and then an app. And so it was looking to give them additional monies to be able to expand on their services so that they could also accept texting and youth reaching out to them that way.
So, and that app is now up and running?
I believe so, yeah.
Okay, all right, very good. Commissioner, you talked a lot about 4S and Spark. So the question that I have with 4S, and I'm not asking you to debate the merits of
Yeah.
the governor's decision or not, is under 4S, did every student that was Tier 2 or Tier 3 have access to it?
Have access to what?
To 4S, have access through NJ4S?
Yeah, every student, there were parameters around, it wasn't for elementary schools, didn't have access to Tier 2 or Tier 3. So, or not private schools didn't have access to that, or schools that had already a school-based, youth services program didn't have access to that because those programs already were providing those services. So for the population of schools, which was the majority of, yes, then every student would have access within those schools to Tier 2 and Tier 3 services.
So, but, okay,
And the Tier 1 was across the board, more schools were.
Right. So putting the privates aside for a second, so K through 5 was covered or not covered under 4S?
Not for Tier 2 and Tier 3.
Not, okay, was not, okay, all right. And, oh, yes. In your budget on pages D38, you're cutting 1.1 million from out-of-home placements, but you're also increasing by 1.2 million family support services.
Trend. Yeah,
Is
it's our
there-
trend account. I mean, it's the, the trend account. So as I was saying earlier, in those accounts, year over year, there might be an increase or a decrease based on, what was spent in the previous year.
Okay, all right, so it's not actually, we're not actually cutting?
That's right.
Okay, all right. very
Like,
good.
if we need it at the end of the year,
You can
like,
move it over?
we need it, then we would get the monies we
Okay.
needed.
And so a lot has been mentioned in the past about, or today, I should say, not the past, wrong word, a bunch of cuts in your budget, right? Whether it's Winona Lippman, Audrey Hepburn, all these other places. And I know that it's a tough budget year. Every department head has gotten that memo. But here's my question. In the FY25 budget, your department lapsed $3 million into the general fund. How much are you anticipating to lapse from the FY26 budget into the general fund at the end of the year?
You don't have a number? Not a significant amount, but we don't have a number sitting here, but we can get that to you.
Okay, all right, I appreciate it. Thank you. Thank you, Madam Chair.